Young athletes who play contact sports are at a risk for a debilitating back injury. Now, a new minimally invasive procedure is helping them recover and get back in the game. Nick Muserino's passion has always been hockey.
My mom took me to a lot of the games, and I kind of just developed a love for the sport.
But after a big hit on the ice, the 16-year-old started feeling severe pain in his lower back.
The way I can describe it is somebody like taking an ice pick down like your spine.
Turns out Nick suffered a PARS fracture.
The PARS is a part of your spine. It can be fractured after repetitive stress and strain, particularly after sports.
It's a common injury in young athletes who play football, soccer, hockey, or ballet.
In fact, some of the fractures will actually heal on their own.
But when Nick's injury didn't improve after 6 months of physical therapy, he was offered a unique procedure.
It's a technique where you basically use a minimally invasive approach to put screws across the fracture site.
Dr. Alan Levy at the University of Miami developed the procedure that uses 2 small incisions.
We put a pin through the fracture. Then we get a intraoperative CAT scan to make sure that the pin is exactly where we want it to be.
Screws are placed across the fractured bone to promote fusion. 6 months after surgery, Nick was ready to get back on the ice. Now enrolled in law school, Nick still loves to get in the rink and play. His back pain is gone.
It hasn't limited me in any way.
Dr. Levy says there is less blood loss and less dissection of the spine muscles, so patients have less pain. Most patients go home the next day after surgery and undergo about 3 months of physical therapy.